Hello and welcome back to the channel. We want to continue our lesson on digestive drugs or drugs of the digestive system. We have looked at acid production reducers. We have looked at acid secretion reducers. Now we want to look at another class, antacids. Antacids. Now these are direct neutralizers of the acid. In other words, these are going to be basic in nature. They are all bases which will directly interact on a chemical level with the gastric acid, which is hydrochloric acid. Now, because this is a direct chemical reaction, this class or group of drugs are described as short-acting, simply because as long as the chemical reaction is occurring, then these class of drugs are effective or are useful. But immediately the base is finished, the reaction ceases. And therefore, the activity of the drug is also stopped. That also means that this drug will give you a fast relief, but it will only give you a fast relief for a short period. Now, because of that, I like to describe this type of drugs as being scam. SCAM. Now, that's just an acronym I've developed to mean that these drugs are fast, effective in relieving symptoms, but are short acting. And secondly, SCAM also means the salts that are used as basic agent to directly neutralize the acid, the gastric acid. So S is for sodium, C is for calcium, A for aluminium, M for magnesium, which becomes the scam. Those are two reasons why I like to say antacids are scam. Antacid is a scam. So that it reminds me of its short-acting, fast relief activity, and it reminds me of the salts that are used as basic agents for the direct neutralization. It's also important to note that because we are using various salts, the side effect associated with the drugs depends on the salt we are using. Meaning, if you are using sodium salt, you may experience side effects that are different from using aluminum salt. So typically, if you use an aluminum salt, for example, you get constipation as a side effect. And if you use a magnesium salt, you get diarrhea as a side effect. If you use calcium salt, you may get constipation. Now, because of that dynamics, there are combinations of the drugs available so that it helps counteract those type of side effects. So, for example, there's a combination of magnesium and aluminum, so that the magnesium, which is causing the diarrhea, the aluminum causing the constipation, can cancel each other out, and you have your drug effectively in place. So that is the idea. All right, now let's look at the uses of these antacids. We should understand that these antacids, because of their nature, remember we have described them as a scam, are not necessarily used for treatment, full treatment. Rather, they are used for symptomatic relief. That means they help you with the symptom, but they do not necessarily treat. So most of the time, they are added to either an H2 receptor blocker or the PPIs. However, we should note that antacids are anti-mixing with any drug. That means you should never mix an antacid with another drug. And what I mean by mixing is when you are taking it. You should always make sure there is a time interval between when you take an antacid and a drug. And you can do it before or after. So you take your medication, let's say a PPI or omeprazole, you wait an hour before you take your antacid, an hour or more. Or if you take your antacid, you wait an hour or more before you take your omeprazole, so that the antacids do not inhibit the absorption of the other drugs. And that is why we never mix antacid with other drugs. So antacids are anti-mixing with other medication. All right. Now, so we said we use them for symptomatic relief of symptoms like acid reflux. Acid reflux basically referring to the acid going back into the esophagus, and it gives you symptoms like bitter taste, persistent dry cough or pain when you are lying down. And all these symptoms are as a result of the acid that has come back into the esophagus. And therefore, we can neutralize the acid directly. And that is where the antacid help with the symptom relief. It helps with heartburns. It helps with indigestion. But it is not treating, it is relieving the symptom. If it is a more permanent problem, or if it's a more medical condition that requires treatment, you have to use the necessary drug, maybe a PPI, maybe an H2 receptor blocker, so that you can treat it, rather than just relieving symptoms. Relieving symptoms is just to make the patient comfortable, but the underlying cause must always be addressed. All right. Now, so let's look at the side effects of the antacids. First of all, they are general side effects, and those general side effects are basically based on the fact that all these agents we are talking about are basics or alkaline agents. Being alkaline agents, there's the possibility of too much absorption into circulation, excess alkaline in the circulation, and this is referred to as alkalosis. So all antacids can lead to alkalosis, especially if used over long periods of time. Secondly, all antacids can cause rebound acidity, just like we mentioned for the other classes also. And what is basically rebound acidity? We stated it is the increase in gastric acid secretion even after you have stopped taking the medication compared to the acid secretion before you took the medication. And it's just the body's feed or come back a rebound because we were trying to reduce its acid level. Those two are general side effects for all antacids. Then, depending on the particular salt you are using a magnesium salt, you may experience diarrhea. And this, we are told, is due to the fact that the magnesium is able to dilate the GI tract. Actually, this also we use this effect in using magnesium salts as laxatives, and we will talk about that later. All right. Then aluminium or calcium will cause you constipation. And mostly this is said to be due to the constriction of the GI tract caused by these salts. Constipation. And if you are using a sodium salt, sodium retains fluids. So you could end up having fluid retention with the sodium salts. So we advise that if you have a patient who has heart failure or is dealing with some form of edema, probably as a result of the heart failure, you use with caution sodium salts. For heart failure, you avoid as much as possible sodium salts. Calcium salts, besides causing constipation, can also cause excessive calcium, too much calcium being absorbed into circulation or systemic circulation, which is referred to technically as hypercalcemia. Hypercalcemia. Then there's also the side effect of milk alkaline syndrome. Now, this is peculiar to calcium, where the milk is referring to the calcium. The alkaline is basically referring to the alkalosis we have described above. So milk alkaline syndrome, where there's too much alkaline in circulation and there is too much calcium. So hypercalcemia plus alkalosis is basically being described as milk alkaline syndrome. Then you can have low levels of phosphate due to the fact that the calcium binds to the phosphate in the GI tract and reduce the absorption of the calcium. So you can have low levels of potassium, low levels of your potassium in the circulation. Low levels of potassium in circulation. So those are antacids. Very brief, very simple for symptomatic relief. They are always added or they are used mostly as adjuncts to help with the symptoms of our patients. All right, so that is antacid. That brings us to the end of this particular lesson. Don't forget to subscribe to the channel. Also like the channel. And once you subscribe, notifications will be sent to you when new content are uploaded. Thank you very much for your continuous support. Lord bless you. Have a wonderful rest of the day.